Government of Tamil Nadu for inviting us for this very mega, I can say a mega conference. I think one of its kind in the entire country. I have never seen such conference in any of the other states. So many congratulations to Department of Public Health here in Tamil Nadu. So my topic here is on digitizing the immunization program of our country. And our country has graduated from EVIN to COVIN and now to UVIN. I'll briefly touch upon all these three platforms, more so on UVIN, which Dr. Vishesh has already mentioned. So I'm just showing this slide, which already I think Dr. Vishesh has mentioned, the magnitude of universal immunization program in our country. Now, it's up to us whether we look at it as a magnitude of the problem or the scope of work which we have. You see, almost 2.9 crore pregnant women, 2.6 crore infants every year, annual. That's the cohort which gets added every year. And all of us are continuously working for vaccination of this cohort. If you see in terms of numbers, almost 1.3 crore vaccination sessions which are being held both at the facilities and in the outreach. Then birth to 16 years, which Dr. Vishesh was also mentioning, not just limiting us to 5-year age group, but also completing the TD10, TD16, I mean, all the vaccination groups. And to cater all these groups, we have a network of almost 30,000 cold chain points or the vaccine storage points across our country. So we have to digitize this entire program. Now, what is the scope of this immunization program as far as digitization is concerned? Both from the supply side and also from the demand side. If I talk about the supply side, or basically the logistics issues, we have to have the inventory management, forecasting and planning for the vaccines, and also cold chain monitoring. So this entire thing has to be digitized. And then if I talk about this demand side issues, the appointment and reminder systems for the beneficiaries, education and awareness that why vaccination is important, and then accessibility and convenience for the beneficiaries to approach the sessions, to come to our sessions and get vaccinated. So this entire thing has to be digitized. Now, what are the supply side challenges? I mean, if you have to digitize, what are the challenges we have faced? You see, lack of real-time visibility, then no visibility of storage temperatures. I mean, when even was not there, then short shelf life of vaccines, non-standard record-keeping practices. People used to write in registers, some of them used to write in hand-made registers. So all sort of these were the challenges which we have to address using a digital software or a digital platform. And as all of you know, our country has a very complex vaccine supply chain, right from the manufacturers to the last cold chain point. So it goes from the national level or the manufacturers to the state stores, divisional stores, district, taluka or the block level stores, and then the last cold chain point. And from there it goes to the session sites. So that's how the complex supply chain management is. Now tell me, what if the army is short of bullets? What will happen? Anybody? Will they be able to win the war? No. So what if the magic bullets, we call them vaccines in our program, if they are inadequate, what will happen? Will we be able to win the war against vaccine preventable disease? No. So that's the importance of supply chain management and the adequacy of the vaccines. So as a program manager, as a PHN, as a MOIC, these are the basic questions which come to our mind. Where are my vaccines? Are they in adequate quantity? And are they stored in the adequate temperature or the recommended temperature? And to answer this, Government of India has implemented this program, Electronic Vaccine Intelligence Network. Not only just Government of India, but it's throughout the country. All the state governments across all the states across the country, they have adopted this system, which is Electronic Vaccine Intelligence Network. What it does is, you can have the entire network of cold chain across the country, and what it actually does, the record-keeping practices have been standardized, and they are digitized on the platform, and also we have the temperature loggers which give us the real-time temperature of our cold chain points. of our cold chain equipments. And all this is shared at a cloud level. And from the cloud level, you have those reports, analytics for the program managers, for the workers, and both at the state and national level. So this is how it is helping us to innovate and to implement. Ma'am Vijaya was telling in her presentation that we have to work more on research, but that research has to be implemented. So this is one of the very good example where the research was done. It was piloted initially, and now it has been implemented across the country. A very good example of digital tool, I would say. So this is how it works. And at the end, if you see what is the cost effectiveness, so anything where the money has gone, it should be cost effective, especially in a public health program like this. So even it has already proved that, and there was a techno-economic assessment of this program, wherein it has proved that if you invest $1 or say 1 rupee, the return of investment is almost 3 rupees or $3. So it's almost thrice. So that's how that shows the cost effectiveness of this program. Now, coming to that was about the supply side. Now coming to the beneficiary side. And when all these questions, Government of India thought that, okay, we have digitized the supply chain management. Now let's talk about digitizing the beneficiary aspect of the immunization program. And when all these questions were going on in the minds of policymakers, what happened? COVID struck. The COVID pandemic came. And to do away with this pandemic or to fight with this pandemic, what was the slogan given by our Honorable Prime Minister? Test, treat, track, and Tika. So Tika is nothing but vaccine. So that COVID vaccination was the major tool to fight against this pandemic. And to have this Herculean task of COVID vaccination across the country, this particular platform, which is CoWIN, has really helped us. And I believe all of you must have taken your COVID vaccination certificate, right? I hope, yes? Yes. So this is where this platform enabled the COVID vaccination certificate, the COVID vaccination system. And I believe the DPHNs here, the PHNs or the VHNs here, all those who are sitting here, and all those who are also having lunch, you must have worked on CoWIN platform, right? So getting the beneficiaries, searching them, and vaccinating them, and providing them the certificate, e-certificate, vaccination certificate on CoWIN platform. So why was this important? This is one of its kind in the entire world, such a huge network, such a huge platform, wherein we have data of almost 2.2 billion doses, 2.2 billion doses data, and of 1.2 billion people on the platform, and it's a single source of truth. And it's not that somebody who is vaccinated in Delhi cannot be vaccinated in Tamil Nadu. So it was that interoperability for the migrant workers, for the migrant beneficiaries was there. So that's how we could manage the entire COVID vaccination program. Imagine if there was no CoWIN system, how would you register and vaccinate each and every beneficiary and giving them handmade certificates? Very difficult, right? So this is the entire system. This is the first time where the beneficiaries were also able to take appointments. They were able to take decisions for their own vaccination. That, okay, I would take the first vaccination in Tamil Nadu, second I would like to have it in, say, Rajasthan. So that was made possible using this portal. So based on the learnings of this particular portal, Government of India thought, okay, let's have the similar portal for routine immunization also, to benefit our workers first, and of course the beneficiaries. And what was this portal? Again, I am showing this slide again. Initially I have shown it for the magnitude and the scope, but this is the program which is now being digitized across the country. This is one unified single portal on the theme of CoWIN, but with added modules and added advantages over CoWIN. The session planning, everything is being done by the facility themselves. Yeah, by themselves. And also there is a citizen portal wherein they can take appointments. They can see that, okay, where are the sessions being held, and they are able to take when I say they, means the citizens are able to take the appointments. So this is a single source of truth, UWIN, again for the routine immunization, similar to CoWIN. And some of the key features of this particular portal, you can see updated on real-time basis. All the delivery points, whether public or private, they are supposed to be on this platform. And why is this important? To capture the cohort of newborn right from the birth on the platform, so that you do not miss them. No left outs, no dropouts. Unless we have a beneficiary on any platform wherein we can track, how are we going to track them? So this is a portal wherein we will capture, when I say we means the system will capture the newborn right from the delivery point, and then that newborn will be tracked for the entire course of vaccination. Due list for vaccinators and mobilizers. Very important point for the vaccinators and mobilizers. You will be getting your due list, your vaccinated beneficiary list right from the portal. You don't have to maintain your registers. Especially for the ASHA workers, the mobilizers. You can simply download your due list from the mobile. The ANMs, the vaccinators, you can simply see that, okay, who all have been vaccinated. And if this child has gone somewhere else in the country, whether that child has been vaccinated or not. So you can keep a track of vaccination record for your beneficiaries. So that's the importance of having this platform. So these are the modules. Administrator module for all the admins, right from the national level till the medical officer level. Then we have the delivery point module for both public and private healthcare facilities. Vaccinator modules for the vaccinators. The mobilizer module for ASHA workers. And the citizen module, very important for the citizens. And it's available in both Android application, Apple, iOS application. It's available on web, mobile. All platforms are available. And very soon, the offline version of UWIN will also be launched. So we are just simply waiting for the official launch by the Honorable Prime Minister. And then the offline version of UWIN will also be launched. Yeah. So these are some in detail what the administrator module does. Basically, session planning, session management is what the admin person does at the health facility level. The vaccinator module, again, very important. Basically, you have to start the session. When very important feature which has been put in UWIN is pre-registration of the beneficiaries. The house tour survey which you do, the head count survey which you do, that can be digitized easily on UWIN. For the next time, when you go for the head count survey, you have to just refer your mobile that, okay, whether this person is there on the platform or not. So that tracking becomes very easy, right? So we are going from the traditional method to the e-vaccination certificate. That's a landscape. That's a mega shift, I would say, a paradigm shift, which we are going to make. And it's a digital vaccination record, which you can access, the citizens can access, the beneficiaries can access. And power of 7, when I say anywhere, anytime vaccination has been made possible. Easing the life of every family. When I say family, means the citizens. Easing the life of our frontline workers. Paperless data entry, real-time dashboards, automated line listing of beneficiaries who are due for your next sessions. So everything is being made possible through UWIN. Now there's something called as ABDM compliance. What is ABDM? Anybody? Sir? Although I have 3 minutes, yeah. Ayushman Bharat Digital Mission. So why I'm mentioning it here? This system is first of its kind wherein child ABHA or Bal ABHA can be created. And this ABHA is nothing but a unique ID for a beneficiary. And all of you know there is something called as HFR and HPR. So this in ABDM system or this ABDM ecosystem, when the HFR means the health facility registry, HPR means all the health personnel registered, and the ABHA. When all of this, they come together, that's ABDM's ecosystem. And how is this going to help? Any software, any portal is being made in the country now, they have to be ABDM compliant. For the seamless data flow between the portals. So that's why this is very important. So this UWIN is the first portal where child ABHA can be created, and then that child can be tracked through any other portals also. The beneficiary will have the records in one place. This is something in the lines of electronic immunization records or electronic health records. This is what is the step towards that. Integration with Poshan Tracker. We have been listening about the nutrition since morning. So yes, this portal will also be, it's already integrated with Poshan Tracker, which is an official portal of WCD department, ministry I would say. And the Anganwadi workers are also eager to know what is the immunization status of our beneficiaries. So they will be able to track the record from UWIN in their portal, in the Poshan Tracker. Then digital platforms for all. It is available in 10 regional languages. I would say now 11 regional languages. It's also available in Tamil, in Telugu, in Bengali, and in all the regional languages it is available now. And that's the 24/7 support, which is a technical helpline similar to CoWIN. All of you know that there was a helpline for CoWIN wherein anybody can call, the users or the beneficiaries. Anybody can call and get help. So similar to that, it's there in UN as well, and it's 24/7. It's running successfully. And also there will be a grievance module which will be there on the citizen portal, wherein they can register their queries and get solutions from the helpline. So what are learnings are there from this? This is my last slide. What are learnings are there from these portals, or this journey from EWIN to CoWIN to UWIN, where like somebody has explained in the earlier sessions also, that whatever we do, it should be replicable, it should be scalable. I mean, that idea should be implemented. And here I would say the strong government ownership really helped in all these, in the implementation of all these portals. And this is what is required. It's all going to be over. Thank you. Then the dedicated and skilled human resource. All of us who are present in this hall, everybody is involved in this. Building standard operating procedures. Like I said, no registers, no handmade registers. A single platform for the entries of vaccines. A single platform for entering the beneficiaries and their vaccination records. A single platform. So standard operating procedures for everything. Then regular capacity building and review mechanisms. Yes, there are systems in place. There are teams in the field who are doing regular handholding and giving handholding support to the users. And in terms of technical, if I say how to scale it to other regions of the world, traditional database to big data architecture. It's not just a small database. It's based on big data architecture, which can be replicated anywhere. And it is capable of taking, when it can take 1.2 billion of our country, it can go to any level. Authorized access to security audit. Yes, you know something called as data privacy and data security. So all those compliance have to be maintained. Licensed products to sustainable open source. This for the managers. It's an open source platform, all these platforms, all these portals, so that they can be integrated, they can be replicated anywhere in the world, I would say. And then data triangulation to API based. Instead of taking data from multiple portals, why not integrate them and have the unified reports on one platform? So that is what is the future. And this is all about the digital platforms. Thank you.
Sir, thank you for the excellent presentation, and good news that it is going to be offline, and that will take us very close to the single source of truth which you mentioned. Thank you, sir.
Thank you, sir. We request Dr. JD MCH, sir, to felicitate the speaker.
Dr. Pankaj, it's not a question, it's just a clarification, because which I have already raised to you on many occasions. Because we in the forum of all my field staff, all working over here, and what I already told to you, they have a burden of entering into multiple portals. So their query is only of entering into from the PICME into the UWIN, or UWIN to PICME, whatever the possible. I have already addressed to you, and I think you are working at that stage. It will be better if you are able to tell them at what earlier we can get the integration into ACT.
Yeah, so what Dr. Vinay sir has said about the integration of existing portal with the newer one, with UWIN. So already work is already going on. And like I've said, regarding the ABDM compliance and having that single unique ID, it can be integrated either through that unique ID, that ABHA, or it can be done through the various other parameters. So already work is going on. But it's always advisable to have a single platform for the entry. Let me tell you again, I think in future, all those entries into RCH platform which were been going to be which you have been doing, as far as immunization is concerned, they will be stopped, and all the entries will be only in UWIN. Already there are multiple letters from the ministry, from Government of India, to make the entries only in UWIN portal. And like I've said, the importance is about vaccinating the migratory population especially. I mean, if somebody is migrating from one state to another state, you will be easily able to track those beneficiaries, and that will be possible only through this platform. Why? Because there is a single database across the country. But as far as the integration is concerned, yes, the work is going on, and this platform is already integrated with various other portals like Push and Tracker, SafeVac, for reporting of AFI, which can be done directly now on UWIN by the vaccinators and by the DIOs. So yes, we are working on it. You will have a single portal, whether say the existing one or the UWIN, to make the entries, and we will be visiting again with the experts, with our team, to Tamil Nadu again, that how to get it integrated with the newer portal. So that will be done very soon. But I would again suggest, since delivery point modules, which is for the private facilities, which is not there on any other portal, all of them, they should be on this portal, and even the public health delivery points, because the idea is to capture the cohort or the birth cohort directly on the portal, and then to track them further. So that's the importance of having a single platform, so that there is no break in the continuity of that tracking mechanism. So very soon it will be done, sir.
Thanks, Pankaj. இது உங்களுக்காக தான் இப்போ இது கேட்டது. அதாவது 2 இடத்துல என்ட்ரு பண்ண முடியாது, ஒரு இடத்துல என்ட்ரு பண்ணுறது இங்கே வரணும் அப்படிங்கிறது தான் உங்களோட இதுதான் இப்போ சொன்னது. அது என்ன பண்ணுறாரு, ஒரு போர்ட்டல்லேருந்து எடுத்து பண்ணிட்டு இருக்க ஒர்க் இருக்கு, ஒரு போர்ட்டலோட நிறுத்திக்கிறதுக்கு பண்ணிட்டு இருக்கேங்கிறார். ஏன்னா இது உங்களோட இதுக்கு முன்னாடி நாங்கள் அவங்ககிட்ட இந்த யூவினை வந்து முழுமையாக பயன்படுத்தாமல் இருக்க காரணம், இன்னொரு முறை எங்கள் விஹெச்என் இன்னொரு போர்ட்டலில் என்டர் பண்ண மாட்டாங்க அப்படிங்கிறதுலாம் நின்றுட்டு இருக்கோம். இப்போ அவங்க ஒத்துக்கிட்டாங்க. இப்போ ஒத்துக்கிட்டு என்ன சொல்கிறாங்கன்னா, கூடிய விரைவில் அவங்க ஒரு டீம் வந்து இதை இன்டகிரேட் பண்ணி ஒரே ஒரு என்ட்ரிலேருந்து அங்கே போகிறதுக்கு வழி பண்ணுறேன்னு சொல்லியிருக்காங்க.